I'm Dr. Mandell. I want to talk about decompression therapy. Decompression therapy is decompressing the discs. This is the spine, and we're concerned about the cervical spine. It's supposed to be a C-shaped cervical lordosis in the curve of the neck. This is the back of the head, the same way I'm standing. This is the back of the vertebrae, the front part of the vertebrae. You can see the disc spaces between the vertebrae. And if you look at the back here, these are the nerves that exit off the spine. And when there is any compression on these nerves, that will affect the neck down into the arm, into the shoulder, into the chest, down the shoulder blade, potentially back into the head, behind the eyes. It can lead to headaches, pain, tingling, numbness, cramping, and or all the above. If you notice, if there is compression on a nerve here, and we have irritation on that nerve, our objective here is to decompress. And by decompressing, we want to open up, if you can look here, how it stretches, we're opening up the pressure off the nerve root. Now, when you lay back here, if you just pull the spine straight out and you do not have the proper angle, decompression or tractioning of the neck is all about finding the right angle, because everyone's facet joints, which are the back of these joints right here, are angled a little bit differently. So we cannot standardly or tell every patient to do traction the same way. So the nice thing about the decompression table is that we can actually change the angle when the person lays face down. So if I was going to put the spine here, the back of the head, as if this spine was laying on their back, you can see the angle of the head when it flexes up or it goes back down. So having the right angle as this unit decompresses and pulls outwards, we can then decompress that nerve the correct way. Okay, as I'm laying back on this decompression table, you can see the mechanism of how it comes down to relaxation and how it's going to pull superiorward as it actually decompresses. Like right now, the machine is pulling outwards, it's decompressing the disc, and it's pulling in the specific angle as the headpiece is adjusted. It's actually going to hold that pull for 45 seconds, and when it comes back, it's always going to have 25% of the normal tension that the pounds are set on right now. For example, I have 27 pounds of pressure being pulled superiorward. As it comes back, I'm going to have 25% of that 27 pounds at the end when it comes back to rest. The reason is you always want to keep contracture on that muscle and never totally let it relax, because it can spasm. So as it comes back down, it's going to keep that 25% contraction so the muscles don't go into spasm. When they totally relax, the muscles can spasm, and then it's going to continue to pull out, and it's going to hold it again for 45 seconds, come back down, hold it for that 25% contracture, and then eventually, when the time limit is done, however long we set the time for, 7 minutes, 10 minutes, 12 minutes, that would be the total session. After we complete it, we take the strap off, and then we want to move our head side to side for about 30 seconds to get the muscles to relax again, to make sure they don't splint and spasm. Then when you get up, you're going to come up, sit up on the side of the table. Do not ever come off any kind of traction right away, because let the blood circulate away from the brain and to the brain so you don't get too dizzy when you get up. Then when you come up, again, you use your arms and you lift up like this.